I'm Dr. Bowers, and in this video I will be discussing a stretch for the psoas muscle. Stretching can cause injury if done improperly, and some medical conditions make it more likely that someone might injure themselves stretching. Someone likely should not do this stretch if they have ever dislocated their hip, have a hip labral tear or sprain, or had recent trauma or surgery in the area being stretched. Always make sure your physician or bodywork professional has deemed an exercise or stretch safe for you. What is okay for one person may cause serious harm to another. Here are some general rules to keep in mind when stretching muscles. 1. Only do if your physician or bodywork professional has instructed you to do the stretch. 2. Stretches should not hurt. Stretch to tension, not to pain. 3. Only hold muscle stretches for 30 to 60 seconds maximum. And 4. Slow, deep breaths help to relax and stretch the tight tissues. There is one psoas on each side of the body, left and right. Each one attaches to the lower back at the lumbar spine and to the top of the leg on the femur bone. When this muscle contracts, it causes the hip to flex and the thigh is rotated outwards or externally. Many people do a psoas stretch while kneeling, but this can put abnormal stress on the knees. Other people try to stretch the psoas in a standing lunge position, but this can be difficult for people with balance issues. Using a bed to stretch the psoas is a safer alternative and allows for better isolation and a better stretch. This stretch stretches one psoas at a time. The body and the leg on the side of the tight psoas is supported on the bed. The other leg is off the bed with the foot on the floor. The patient uses their hands to push their body up until they feel tension in the front of the hip on the side of the tight psoas. Hold this position for 30 to 60 seconds. Now let's watch a video demonstrating this, but keep in mind that the patient should hold the stretch longer than this video while taking several slow, deep breaths to relax into the stretch. I have made this video as a resource for other physicians, body workers, and my patients. I cannot recommend that you do this stretch unless I have examined you, obtained a thorough medical history, and deemed it appropriate for your individualized healthcare needs. It is only safe for you to do this stretch if you have been instructed to do so by your physician or body worker.